Well, if you're planning to hit the slopes this winter, doctors are hoping you avoid some common mistakes that lead to common injuries. Two local sports medicine doctors are here now to tell us about how to avoid some of these injuries that are both unique and, more importantly, completely avoidable. Joining me now is Dr. Joe Guettler and Dr. James Bicos with Michigan Orthopedic Surgeons. Doctors, thanks for joining us today. I appreciate it.
Yeah, thanks for having us.
And this is such a timely thing to talk about, as people probably already hitting the slopes or getting ready to hit the slopes. So, Dr. Guettler, I'll start with you. Let's talk about skiing. What are some of the common injuries that you have to deal with this time of year with skiers?
So the most notorious injury is the, quote, knee blowout. We have a little model here. What is a knee blowout? Well, we commonly think of the ACL. And when your ski catches an edge, your binding doesn't release, the knee can get torqued like this.
Oof.
And there goes the ACL, maybe another ligament, maybe the meniscus.
And so, Dr. Bicos, for you, I see you got a snowboard here. What are the injuries that you deal with the most with snowboarders?
Yeah, so snowboarding a little differently because the stance is different. So both of the legs are hooked into one board. So you're either going to get a forwards or backwards movement to fall. So typically when you're going to fall, you're going to put out your hands, extend your wrists. So wrist fractures are significant. And also a concussion as you get that whipping effect, that can also happen.
And so some of the things that both of you advise winter athletes to do is make sure that they're wearing the proper equipment. Mm-hmm. How does that come into that? Whether it's a helmet, I see you have some wrist guards there, or binding. I guess, Dr. Guettler, we'll start with you. How big of a role does having proper equipment play in avoiding these?
Very important. And I would say the binding is the major link in the prevention of blowing out your knee. You need to make sure when the kid is adjusting your binding at the ski shop that they're paying attention. When push comes to shove, that needs to release so you don't torque your knee and end up with the infamous blowout. But all equipment is important. Helmets, wrist guards for snowboarding, extremely important.
I'm thinking about wrist guards, and I actually do more skiing than I do snowboarding, but when I did snowboard, whenever I would fall, I did exactly what you said.
Yeah.
I was putting my wrist down. So do you have equipment that you would recommend snowboarders use?
Yeah, wrist guards are simple. They're actually pretty light. This is a set, so they kind of go on the front of the wrist, and you can kind of see they're pretty hard. So when you're going to fall, it's going to basically break the fall for you. And the other part, they're kind of warm too, so again, as you're out there, snowboarding, it's going to keep your hands warm.
Dual purpose, yeah.
Exactly. The final thing is going to be the helmet. Definitely, will help prevent a concussion. The other benefit too, again, keeps you warm. Obviously, it covers the ears. You can put music in there too, and they're pretty stylish nowadays too.
I didn't know that you could get helmets that actually play music inside. Another reason to have one. And of course, the two of you as physicians, you deal with all types of injuries, avoidable and unavoidable. But for injuries like this, I mean, these are such avoidable injuries. What are some of the common mistakes that people make out there? You mentioned maybe not properly preparing.
Not warming up. It's important going into a ski trip. We just got back from Vail. You want to try to the best of your ability to be fit going into the trip.
Sure.
Do a little extra jogging, a little extra stretching. The day of, even if you're an expert skier, start with some greens, start with some blues. Even if your kids make fun of you.
No double black diamonds on the first try?
Even if your kids make fun of you, swallow your ego, stick with the greens and blues, good warming up.
Absolutely. And before we let both of you go, can you tell us where our viewers can go for more information, or if they do have one of these injuries, where they can go to call you to get fixed up?
Absolutely. So one thing is miorthosurgeons.com. That's our online. You can call us at 833-MOS-DOCS too. And then we also have an urgent care facility, that's there for any walk-in visits.
They're hoping that they do not see you, but they are available if need be. Thank you so much, Dr. Bicos, Dr. Guettler. Thank